You're giving a speech tomorrow about consumer-oriented care. There's definitely a growing demand for that in the field. Can you talk a little bit about Novant's approach to that?
Absolutely. So we've been very focused on the reality that our patients are spending less and less time with us. So there's less time that they're in our hospitals, there's less times they're in our clinics. And so we've really approached it as if that whole space when they're not with us is a virtual venue of care. And so we think that consumers are going to want to be engaged with us in different ways more and more. And some significant portion of the time, it's not going to be face-to-face.
And I know using technology as a third avenue of care is something that's been important to Novant. Can you tell me a little bit about why that's important in addition to ambulatory and acute care?
Absolutely. So we think of that virtual venue of care as really literally another venue of care. And so one of the ways that we connect is by technology. But the most important thing isn't the technology. It's what's on either end of the technology. It's the providers and the connections and relationships they make with our consumers and our patients. So yes, technology is a key centerpiece of that, but it's not the only way we connect to folks.
And I also noticed that there was an emphasis on building the technology around the patient versus the technology itself. Can you talk a little bit about how that plays into patient-centered care?
Absolutely. So when you look at patient-centered care, when we built our electronic health record, we actually stepped back from it and said, okay, what's going to be the focus of this? Is it going to be the workflow for our physicians? Is it going to be the workflow for our nurses? Is it going to be how we drop a bill in the system? And we ultimately decided that we really needed to think about how the patient experienced the electronic health record, which when we did this about 5 years ago was a little bit of revolutionary thinking, because we really said that as we built it, what we were going to do is focus on what the patient saw. So that meant creating an online experience, not just a portal. That meant engaging patients when they came into the office and making sure that they were connected to us in some way when they left. And that meant reaching out to consumers who wouldn't even normally think to go to the doctor or a provider and connect with them when they need it, where they need it, and provide, honestly, price points that make sense to consumers, not just the traditional delivery of care.
So creating an accepting hospital culture has also been really important to Novant's creation of patient-centered care. Can you talk a little bit about how you established that and why it's been really important?
So when you attempt to do something different in how you engage patients, it means you've got to have the caregivers on the other side of that engagement. So we were very intentional from the executive team to the frontline person of engaging every person within Novant Health as we built that virtual venue of care for those patients. So it's not just about the technology being rolled out, it's really about how you interact with people. It's how you create an experience when they're with us, it's how you engage with patients when they're not. And so making sure that we had remarkable engagement of our physicians and our caregivers was one of the fundamental things that allowed us to build it.
For H&HN, this has been Matt O'Connor, and thanks for watching.